Week 2, Basic Principles of Pharmacokinetics and Pharmacodynamics. I'll sure you all agree that Week 2 was pretty intense, but also, at the same time, I think very interesting for everyone because you were able to be reminded of a lot of the stuff that you'd covered in clinical pharmacology with Dennis Chang. So really, it was more of a recap for you, I believe. And what I'll do now is I'll quickly just go through the slides and I'll highlight particular areas that I think might have significance to Assessment 1 when it takes place. So I'm sure you'll all agree, pretty interesting area really is pharmacodynamics and pharmacokinetics, and I'd expect you to know exactly what pharmacokinetics and pharmacodynamics means and how pharmacokinetics breaks down into ADME. So make sure you're familiar with definitions. You don't need to worry about Trovan or alotrafloxacin or anything like that because there's not going to be any questions around it. I was really using it as an example to get us to really think about how drugs move throughout the body. I want you to know about how drugs move from site of admin into circulation. So obviously you're going to know about diffusion, well, passive diffusion, facilitated diffusion, and then, you know, your active transport mechanisms. I mean, passive diffusion is the main one by which drugs move across different membranes, cell membranes as it were. Factors that impact on absorption, don't need you to have really detailed knowledge about it. Acidic and basic drugs and the attendant concepts that go with it. Yes, please, make sure that you do know it. So what acidic drugs do and what basic drugs do. And what pKa means as well. And then, you know the impact that acidic and basic environments have for drugs that are acidic or basic depending on the pKa. So, with an acidic drug, when the pH is higher than the pKa, what does it mean? When the pH is lower than the pKa, what does it mean? And then for a basic drug, when the pH is higher than the pKa, what does it mean? When the pH is lower than the pKa for the drug, what does it mean? Make sure you're familiar with that, and there's a few little resources to help you with that now. So yes, please, the consequences for pH for acidic and basic drugs, you will need to know that. You don't need to know about particular pKa's for drugs or anything like that. And you don't need to remember which drugs are acidic and which drugs are basic. It's my job to tell you. As far as routes, you know, for drug disposition, routes of drug administration are concerned, don't trouble yourself too much with knowing that in detail, because I never went into lots of detail with you anyway. Factors that affect absorption of drugs from the GI tract, if you just remember some of the factors, that will be quite good. What is hepatic first-pass metabolism? What is bioavailability? You may have to tell me in Assessment 1. What is first-pass metabolism? What are the consequences of that for bioavailability? You may have to tell me. Enterohepatic shunting, make sure you're just familiar with what that means. I don't need you to tell me about any specific drugs and the implications of enterohepatic shunting, but what are the implications of enterohepatic shunting for bioavailability? Might need to think about that one. So bioavailability, make sure you're familiar with the concept to repeat myself. Body is divided into two compartments for the purposes of distribution, fat and water. Just knowing that will be enough. Factors that affect drug distribution. You don't need detailed knowledge on that. This is a 20-question multiple choice quiz. So just make sure you go over the information. Please give some thought to perfusion limited and permeability limited drugs. Just what it means. Just that concept, because I might try to test your understanding around that. Factors affecting extent of drug distribution. I'm not really going to ask you any questions on that in Assessment 1. Plasma protein binding, just be familiar with plasma protein binding as a concept. 4 overall types of drug distribution. I suppose you could remember the 4 overall types of drug distribution, but I'm unlikely to ask you detailed questions on it. Volume of distribution, yes, I need you to know volume of distribution. What does it mean when a drug has a really high volume of distribution? What does it mean when a drug has a really low volume of distribution? Metabolism, phase 1, phase 2, some examples of phase 1 metabolic reactions. That will be enough. What are prodrugs? You may have to tell me in Assessment 1. just what is meant by phase 1 and what is meant by phase 2 metabolism. That would be helpful. Factors affecting metabolism of drugs. We're only going to be, what, 5 weeks into the content? I'm testing your knowledge from week 1 to week 4. You will not need to know that for assessment 1. What is meant by zero order kinetics and first order kinetics? I already told you about it. It's in the recordings. There is a possibility that I could ask you one question on first order, zero order kinetics. So review my lecture, and I might just have done you a really big favour. Excretion of drugs, I talked about it briefly. Glomerular filtration, tubular secretion. Not really going to ask you questions on it in assessment 1. Clearance, I could ask you questions on what is meant by clearance for a drug. That would be reasonable, as would questions around half-life and elimination. Remember, don't confuse clearance with elimination. Steady state plasma concentration. Not going to ask you I'm not going to ask you lots of questions about it in assessment 1. There's not really going to be any questions on it, but you know what it means because I've told you. And 5 basic types of drug action. Yeah, remember that. I could ask you around that. I'm just going through this quickly because there's not really much I can tell you because there's not lots of information that you're going to be asked about in terms of assessment 1. Then we looked at pharmacodynamics. So 5 basic types of drug action. Remember the 4 main types of receptors forming as well. Do not need to remember any kinds of signal cascade pathways. As much as I like them, I'm not going to expect you to memorize it or even tell me about it. What is an agonist? What is an inverse agonist, antagonist, competitive and non-competitive antagonist, partial agonist, full agonist? Make sure you've got some definitions down, and I do believe that our flashcards could be really helpful there, because I've got, what, eight of you in my Quizlet group, and we're getting really lonely, so think about signing up, because those cards could help you revise for assessment 1. And that's really it. I'm not going to ask you about the ABCD concepts around pharmacokinetics or anything like that. No, I'm not going to do that for assessment 1. I think that as long as you've got as long as you know what the key concepts are. So I've just highlighted things to you now, going through this presentation. As long as you know what those key concepts are, what they mean, what they represent, that will be enough for assessment 1. Really don't want everyone getting worried about assessment 1. It's not going to be too much to worry about. Anyway, let's move on to week 3. I'll see you soon.